There is the argument that by confining this population of workers within the conditions of their dormitories, obviously very, very tightly packed, limited ventilation, shared spaces, that you're actually creating more of an environment for higher transmission than actually preventing the problem that the policy is aiming to help.
Well, there are many purpose-built dorms and different kind of dormitories in Singapore. And as you know, Singapore has faced a challenging time with the COVID outbreak, with the first wave really from imported travelers. And then the second wave really was in the locals. And then a large proportion of the cases have been in migrant workers. These migrant workers, the dorms that they live in are not monolithic. But over the years, I think in the late 2000s and late 1990s, more purpose-built dorms were built. Now, these are higher in density, and we've been down. I work also for NGO, and many of my health colleagues work also with these migrant workers, and they are housed in quarters which are purpose-built, and they are rather high density. Now, the ventilation is natural in most of these dorms. And right now, as of August, as you know, after the large migrant outbreak that we had, most of the dorms, actually the dorms as of early August, have been mostly screened through once. Now, it's going to be quite challenging to eradicate COVID-19. I don't think this is a scenario unique to Singapore. And gradually, I would say that the movements of the migrant workers and other sectors of the economy are opening up. So I think it's a work in progress, but right now, and I think based on whether certain populations have been evaluated, whether they are seropositive, whether they have been infected before with COVID-19 or they have recovered, these are migrant workers are then moved into new dorms and also...
Dr. Vasoo, I'm curious,
yes.
Will the government be looking at expanding testing within dormitory environments, particularly when it comes to individuals that may be shedding the virus and then that transmission happening through aerosol or fomite transmission? Is that something that will be looked into?
Yes, right now for the migrant workers who live in dormitories, there is a schedule of actually routine testing where they are tested currently at every about 2-week intervals to make sure that we pick up new infections. There is also a national database where we track not just in migrant workers, but also in Singapore, people who are infected with COVID or not. And that's how we, it's rather tricky sometimes because there is a phenomenon of persistence of our RNA in sampling, but people are actually recovered. They're not actually infectious. So there's an ongoing program to detect these new infections. And also sometimes we pick up old shedding, but we need to differentiate, and that's how this database helps.
Let's turn to vaccine development. We have now seen the AstraZeneca clinical trial being paused because of illness in their patient. How satisfied are you when you look at these front runners in the vaccine race about how safe these clinical trials are and the safety of the eventual development of a vaccine?
Well, I think, as of early September 2020, there are at least 45 vaccines undergoing phase 1 to 3 trials. Majority are really in the preclinical phase. There are several front runners, as you know, including the AstraZeneca vaccine. And there are many vaccine types, including the traditional inactivated vaccines, vector-based vaccines, mRNA vaccines. I think what the news yesterday about the AstraZeneca trial being paused is a safety pause to evaluate an event in one of the patients. And I think we are still waiting to hear further reports from that. I think it's a safe thing to do. I think we want to ensure that a vaccine is both efficacious and safe.
But
Right
could
now,
this vaccine race that we're seeing globally lead to lax requirements of safety here?
Well, the regulations which are in place, then whether it's the FDA or other regulatory bodies, have certain regulations in place to make sure, and each country has its jurisdiction. So, yes, in the haste to, I think there are two things. You're right. One is safety, which is paramount, and the second is efficacy. We do not want to release a vaccine which is inefficacious, because that might lead to people presuming they are adequately protected. Now, no vaccine is going to be, at least for SARS-CoV-2, it is unlikely that the vaccine will be 100% effective. In fact, if you look at the other respiratory viruses, if you hit anywhere in the ballpark of between 50 to 60%, I think that's really a very good vaccine. So we want both efficacy and safety.
Yeah. Dr. Vasoo, just really quickly, we have seen the reinfection case confirmed in Hong Kong as well. Earlier, Singapore this year had said that you haven't seen any significant mutation in the virus as of yet. Given all of these changes that we're seeing and still trying to understand how the virus operates, have you, the center and the government of Singapore, changed how you tackle the virus and the pandemic?
Well, I think that reinfection cases emerge is not a very big surprise, because we know that it happens with respiratory viruses. We know that at least from SARS 2003, and also with what we know of SARS-CoV-2 now, that there's at least in the majority of people some short-term durability and immunity. Now, we have been looking for reinfection in Singapore in our patients who represent with respiratory symptoms, and also as part of screening activities, but so far we have not found cases. The few cases which have been described worldwide, I think as labs ramp up capacity in genomic sequencing and testing, we might identify more cases. But I think it's important to understand that right now, at least, these are a handful of cases in a large denominator of people who have been infected, but we need to get more information.